Hola, y'all. So today is the official day of my surgery. As I previously mentioned, I have gotten some minor nerve damage going through my elbow, all the way up my wrist, and then I also have trigger finger. This is a brace I've been wearing to help relieve the pain and discomfort that I feel throughout the day, super, especially at night. Sometimes it's irritating to pick up my baby, which sucks. And so I went to the doctor a couple months ago. The pain started in August. Went to the doctors a couple months ago and they did some testing in regards to my nerves, and they found out that the nerves are not firing properly all the way up the hand, which is causing some of the issues. I've had numbness in my fingers, tingling, not as consistently, but when I put pressure here, they go numb really fast, which apparently is not normal. I didn't know that. And I guess it's very common in women, also women who have had babies, because when you're pregnant, you have increased inflammation and fluids going through the body. And I guess it can swell some of the joints in the sheaths and then basically put pressure on the nerves. So they're not firing. So that's what's happening. And with my thumb, it's constantly clicking and it hurts to extend. It hurts to bend. Usually if I don't have the brace on, I'm holding it like this. So they're gonna be doing a small incision right here to relieve the nodules and allow the tension of release. They're also gonna do a small incision here to free up some of the sheath so the nerves can fire properly to my fingers. And they're also gonna do a small incision here. So this is my first time having the surgery done. The doctor said that I may have to have it done on the other side as well, because there's nerve damage on the other side. The main concern is the sensory and motor nerves. No, well, the main concern is really the motor nerves, because essentially if it gets worse, I will have less functioning in my fingers and my hands, which is not good, because I definitely want to have a second baby. So he recommended going ahead and getting surgery because this will help when I do have a second child and I won't have these issues. I could wait. I could just see if it gets better or if it gets worse. But the discomfort is so annoying and constant that I really don't want to go through this for another 6 months to a year. My husband recommended just waiting because I'm still breastfeeding, and obviously my body's still healing because it's only been 4 months. But no, I'm not going to wait. I want this fixed. My mom is here to help with the baby because I won't be able to pick him up for 4 weeks. Minimum 4 weeks, I cannot pick him up. So it's gonna be tough, but that's why my mom's here. She's gonna help me with the baby. She's going to help me, but I feel confident that, you know, obviously recovery is going to take time, but once everything's healed, I'll be back to A1. So there won't be any lifting, no exercising or working out. I will start doing some walking on the treadmill after the first 2 weeks. I know this weekend will be a little bit challenging. I'll have a huge gauze on my hand and on my elbow, hence why I'm wearing this big sweater. But yeah, I couldn't have any kind of makeup, no nails, no lashes, no nothing, which is totally fine. You know, don't want anything to come into interference with the anesthesia. So that's happening today. It's November 11th. Happy Veterans Day to all of anyone who's a vet or family who's a vet. My dad is a vet. Thank you, Dad, for all the service that you have done. I know you're looking down on us and watching over me during the surgery. So I will keep you guys updated and show you guys the process and share my experience post-surgery, what it looks like. If you yourself are experiencing these same issues with nerve damage or trigger finger, I did try the exercises. I have a whole little booklet of exercises. That wasn't working. I tried the icing. I tried the brace. I've tried just resting it, but nothing has helped it get better, and it's only gotten worse. So hence why I decided to go ahead and we'll move forward with the surgery. So if you have any questions, let me know below, and stay tuned for what's to come. Keep me in your prayers. So we are here in pre-op. I've been registered. There's Mama. She's gonna be waiting for me after surgery. She has this little thing here. It's color coded to keep her updated of where I'm at in the process of the surgery. I'm feeling a little anxious and nervous because obviously it's surgery, and I have no idea how I'm gonna feel after. Obviously I'm gonna be in pain and I'm not gonna be able to use this hand, but it will be fixed. So yeah. Mom, what are you gonna do while I'm in there?
I'm gonna stay here until I get uncomfortable. I'm going to the car and be more comfortable.
well, she's gonna stay here until she gets uncomfortable, but she'll be fine. So, okay, I'll keep you guys posted. So I now have the IV in my arm. Hair is ready. They wrapped my breast because obviously I'm breastfeeding and they will leak. I have been told that I cannot breastfeed my baby for at least over the weekend. Thankfully, I have stored milk in the freezer because I'm going to be on pain medication, which she cannot get through my boobs. And the pain medication is in my boobs for at least 12 to 24 hours. So I'm gonna have to pump and dump so I don't lose my supply. So I'll be pumping and dumping over the weekend as much as I can until I'm able to breastfeed him. But I'm kind of sad because that's our bonding time. So he will be having to supplement with some formula because I think I only have about 15 bags. Oof, I wish I had more. And he'll be taking the bottle from my mom. So this is a process, but we are gonna get through this. So my mom's supposed to come in and we'll see how it goes. Hey y'all, so surgery went well and I'm now in the car. Mommy is driving. We are going to pick up my pain medicine. My fingers and hand is numb. I can't feel my fingers, but I can feel, well, I can't feel the tip of my fingers. I can feel my actual fingers, which is normal because they worked on the nerves. You can't see, but there's a soft cast on my whole arm, starting from my elbow. I have a little bit of a swollen lip from the anesthesiologist, but I guess it's normal. So now we are again heading to go pick up oxycodone for the pain because once the numbness wears off, the doctor's like, you're gonna want to make sure that you already got that in your system. Okay, so gonna go pick up Bubby, and then we're gonna drop off the prescription, pick up Bubby, and then go pick that up. And then I need to go pump my boobs and release this first set. And then hopefully, later tonight, I'll be able to feed Adele. So that's the update. Feeling good, obviously, because everything's numbed. And, this weekend, just really can't do anything. If I take a shower, make sure it's wrapped. I have to keep it elevated at all times. That's why I got this pillow right here. And my mom has to help me get dressed and help me do a lot of things. So, yeah, it's going to be interesting. But that's why my mama's here. Thank you, Mama.
You're welcome.
Yes. So, I'll let you guys know on Monday, what it's like when they take off the gauze. But so far, so good. I'm happy I got it done. And I'm just looking forward to being recovered and everything's fixed. Oh, and I wanted to mention, when I was in there in the surgery room before everything started and I was out, one of the nurses was like, oh, you have mommy thumb. I'm like, what? She's like, yeah, I had that too. I didn't get surgery though. She got the cortisone shot and she said she still deals with the pain and the discomfort. So that just lets you know the cortisone shot is just a band-aid. And essentially, she's still done with the issue. And you don't really know where it comes from. I'm thinking like maybe it's from holding Adele. Obviously, increased inflammation and fluids, as I mentioned previously. But it's apparently very common. And, they do the surgery often. And even with my boobs, they had to wrap my boobs. And they're like, oh yeah, we have plenty of moms that come in here for this. And I'm like, oh, okay. Didn't know that. So this is something, mommies, just be heads up, this could happen to you. I pray it does not happen to you. But apparently this is a common procedure and a common occurrence amongst women, especially women who recently had a baby. So, yeah. And that's about it. That's all I have to say right now. Just looking forward to seeing my baby and getting this pain meds and then getting to rest and eat. I'm hungry and I'm thirsty. I want some water. I want a good meal. So that's what I'm looking forward to. Just wanted to share a quick video. My mom put Bubby here. This is the only way I'm able to hold him while my hand is resting on a pillow. We're about to put him to bed. He's so tired. Look at his tired eyes. Bubba's tired. Yep. And then I'm going to go upstairs and rest myself. Just finally got something to eat. But I'm going to miss breastfeeding and holding you, Bubby. But this is to heal, so that way when your brother Adonis comes around, Mommy will be good as new. 2 days after surgery, I got to spend a lot of quality time with Adele. I also got to feed Adele, which was great with my mom helping me. And then I got my cast off, and now I started physical therapy. These are some of the exercises that we had to do, along with putting my hands in beans. These exercises were extremely challenging. I know this looks easy, but putting my hands through the beans and actually moving them was extremely hard, especially with the rice. With the rice, I had to squeeze every little grain, and it was really working out. And after these exercises, my hand was extremely sore. One of the most challenging exercises that I had to do was with the putty. I was required to pinch it with my thumb, which was again really hard, along with squeeze it and grip it. And each grip, all I can think of was, wow, I am literally going to be starting from scratch when it comes to my strength. The most therapeutic part of it was getting massaged. This simple light massage was very necessary and also very therapeutic post-surgery. Massage is something that helps relieve some of that scar tissue, so highly, highly recommend going to PT post-surgery. And is this something I can do at home?
Absolutely.
Okay.
3 times a day, this would be good for you to do.
Okay. I noticed everything is about 3 times a day. So like morning, afternoon, night.
Mm-hmm.
Okay.
Now you can do more than that, but at least 3. Okay.
Okay. And then this was how I took a shower and a bath. I had to fully wrap my arm with saran wrap and a glove, so highly recommend. So it is now post-surgery. It is actually January 15th. So it's taken me some time to put all these videos together with not having 2 arms and also being with baby full-time. He's back in daycare. I'm starting next week. I'm going to be able to exercise and lift some weights. I can lift about 8 to 10 pounds now. So this is really just an update. Surgery was definitely necessary. As you guys seen in previous videos, the scar has gone down. I was going to PT 3 times a week. You can also see that the scar has also gone down. This scar though, as you guys can see, it's always hurting, and it's really hard to massage because it's kind of on the area where your funny bone is. But all in all, the surgery was definitely needed. The pain was not going away anytime soon. I did not want to wait 6 months to a year. As the nurse said in the room, she got the injections and she's still to this day, years later, having issues. So if you have any questions in regards to trigger thumb, carpal tunnel, mommy thumb, minor nerve damage post-pregnancy, let me know. I am an advocate of the surgery, especially if you have a great surgeon who I had Dr. Molina with Atlanta Hand Surgery and Massage and Therapy. Can't remember the name right now, but they were great. My physical therapists were great, and they do the surgery quite often. So yes, it's a last resort, but if you've tried all the methods, if you've done all the exercises, you're wearing the brace and you're having issues, like literally it was hurting to pick up Adele, I highly, highly recommend. So overall, was surgery necessary and needed? I say yes. Am I great now? Yes. Have I started lifting? No, but I am going to start lifting, and you guys will see me in the process of recovery and growth with regaining my strength in this arm, lifting, getting back in shape. I'm not trying to get too in shape because again, I do want to be pregnant again before the end of 2023. And so I'm not trying to get snatched just yet, but post baby number 2 is when I will work to really fully regain my strength. But overall, I'm happy, I'm healthy, I'm well. My arm is a lot better. And so that was my surgery. So hopefully you found this video helpful. If you were a mom-to-be, if you were experiencing trigger thumb yourself, let me know. I would love to know if you're a mom who's experienced this. This is definitely going in my book because this was not in any of the books or podcasts or anything about, hey, by the way, you might get this post-pregnancy. So if that was you, let me know again. So please like, please share, please subscribe, and I shall see you in the next video.